All right. So today we have a fairly busy call actually. We'll talk about World Malaria Day. We have colleagues from the Global Fund Secretariat that will come to share their communications plans, and we'll also hear from Impact Santé Afrique about their plans for the Francophone Africa region in particular. After that, we'll hear from the developed country NGO delegation, the developing country NGO delegation, as well as the communities delegation, and just hopefully. And they'll give us a few leads on what to expect at the next Global Fund Board meeting that will take place next week. And finally, we'll take a few minutes for us at the Global Fund Advocates Network Secretariat to report back on our global strategy meeting that we had at the end of the last month in Bangkok. So without further ado, I'm going to move to our World Malaria Day segment. Just a little bit of scene setting before we get started with the presentation. So World Malaria Day this year, like every year, falls on April 25. And some of the key themes that we see across organizations this year are that there's been a stagnation of funding and impact for close to a decade now, which is concerning, extremely concerning in certain countries in particular. Oh, sorry about that. I didn't mean to skip this far. Up, we're back. We have new tools, the RTSS and R21 vaccine in particular, the dual AI nets as well, that are both coming with new opportunities, but also new challenges because of stagnation in resources, whether these new tools are going to be able to be deployed or whether they will be cutting into other responses is going to be a problem and a question. And we have a rising challenge of climate change and political instability. A number of countries that are particularly hard hit by malaria, facing major political upheavals and crisis, in particular leading to a lot of displacement. And that is a major concern. And all of that is worsened by climate change. And we already see the impact in terms of how the rising temperatures and the changing rain patterns affect the speed and the spread of vectors. So there isn't a lot of good news in malaria, but there are new commitments. So there is hope, and I hope I will hear from colleagues that are a little bit more upbeat than I am. And I apologize for the gloom and doom at the opening of the call. So first, I'll give the floor to Ernest, and I'll stop sharing so that Ernest, if you have a presentation, you can jump in, and then we'll move on to Impact Santé Afrique. Ernest, the floor is yours.
Thank you, Conte. I do not have a presentation to share, but I actually want to start by echoing your message there that of the three diseases that the Global Fund fights or we respond to, I think malaria is the one that we are really worried about. First of all, I will divide my very short presentation in two ways with a focus on World Malaria Day. First is the messaging, and the second element would be the content that we are producing. So again, there's a sobering sort of an element to our messaging this year, basically because in the last few years, what we have seen, and it's exactly what you spoke about, Kanta, we've seen stagnation in the fight against malaria. And besides that stagnation is the fact that there are other things or there are other challenges that are emerging, climate change, conflict, but also increasing resistance to anti-malarial drugs and insecticides. And these, of course, complicate the fight against the malaria. So besides stagnation, there's a real risk that, we might have a reversal. The World Malaria Day theme this year is a fantastic one because it talks about accelerating the fight against malaria for a more equitable world. So equity is really at the center of it all. But it's not just the fact that by ending malaria, by fighting malaria, we are creating a more equitable world. It is also the fact that for us to be able to end this disease, equity is going to be very, very important. And I think in the malaria community, and those of you who are in the RBM meeting on Monday, briefing on Monday, what we heard is, WHO is going to have a significant element, or at least a chapter in the report this year dedicated to equity, basically gender equity, and equity in general. And I think this is a bit of a new message when it comes to the malaria community. When we think equity, I think HIV and TB have been big on that, and including the key populations and how an equitable response is really fundamental to ending those two diseases. And I think in the malaria community, the recognition that equity is really at the heart of ending this disease is becoming more and more prominent than we have seen before. So essentially, as we fight this disease, thinking about equity, thinking about in the African continent, sub-Saharan Africa, 94% of the cases and 95% of the deaths, affect this region. But also thinking about women and children under 5. And in a broader sense, of course, we are talking about refugees, migrants, IDPs, and indigenous people. So taking the tools that Kanta just mentioned there, the tools that we have, the new arsenal that we are building from the Duo AI nets to SMC to preventive therapy, and to the new vaccines, and making sure that the people who are most in need of these tools are the ones who are being reached by our efforts, by our response, is very key. So in a nutshell, that is how our messaging will be. But just moving very quickly to the kind of the message, the elements or the items that we prepared for this World Malaria Day. As usual, we have key messages and talking points, and those are accessible to all of us. We will have a World Malaria Day webpage on the Global Fund website, an updated World Malaria Day webpage. We'll have, at a glance, a malaria 2-pager that we will also be publishing. Basically, it's a state of the fight of where are we in the fight against this disease. And there will be an exposure piece. You remember that we just came back from Cameroon. So our team was there and we produced an exposure piece that we are going to be sharing from Cameroon. There will be a Peter op-ed, which will be published on Forbes, and that will again be shared with us. And our head of malaria, Scott Filler, is also doing a LinkedIn post or a blog on LinkedIn. And all this will be brought together in the social media toolkit. The social media toolkit is a big element of our disease days. And this will be shared with us, all of us, on this call, our networks. It will be shared by our social media team by Friday. So the social media toolkit, again, will bring together all those elements I've talked about. It will bring together our messaging for the World Malaria Day. Thank you.
Thanks a lot, Ernest. And yeah, sorry I stole your fire with my opening remarks. I didn't not on purpose. No, thanks a lot. Before we take any questions, we'll hear from our colleagues from Impact Santé Afrique, if that's okay, and we'll just group the questions. So I think Olivia or perhaps Enabu, whichever of you will give a presentation.
It's Ségolène, yes.
Ségolène. Hi, Ségolène. Sorry.
Hi, Quentin. Thank you.
Okay, so nice to thank you for having me. I'm Ségolène Moussala from Impact Santé Afrique, and I'm going to present what we are planning for World Malaria Day. If you would just allow me to share my screen. Okay, so as you have just seen on the video, the key activity we are planning is the CS4Me annual forum. I'm sharing a couple slides about it, which is an annual forum gathering around 800 CSOs and malaria-affected communities to discuss around the theme we have this year. So it's going to happen on April 33rd, and I can share the link in the chat later for anybody who would like to join us on this occasion. We are going to have guests from the Global Fund, from WHO Malaria Program, from expertise friends, and we're going to talking about the fact that there's really no health equity, gender equity, or human rights that can happen without very meaningful community engagement in the fight against malaria. So following the civil society forum, we are going to have a civil society media campaign around that, as you can see on my slides. And for that, we are going to produce a toolkit, including social media, email banners, profile picture filter with the call to action, stickers. We are also working on some curated stories for malaria-affected communities on the ground, some videos, and of course, key messages around the theme of this year to use with all the tools. The social media toolkit is going to go out on the Friday, and an important detail is that it's a white label toolkit. So there's going to be a white banner on all the tools so that anybody interested in putting or marking the logo of your organization, you can do that to push the tools too. After that, we are planning a campaign with parliamentarians, a couple of open nets to be published in countries. Some of you may know about the Parliamentary Task Force for Domestic Resource Mobilization in Africa, which is co-hosted by Waki Health and Impact Santé Afrique around GFAN Africa. And we are going to work with the MPs, members of the task force, to publish key media pieces in their own countries. And the goal for them is to advocate for more national funds to fight against malaria. The countries concerned are MPs from Senegal, from Cameroon, Nigeria, Burkina Faso, Niger, Congo, and Cote d'Ivoire. We did something like that a few weeks ago for World TB Day. So we think it's an important action to have parliamentarians really taking the leadership to talk about the fact that we need more funding for the fight against malaria and the two other diseases. Around that, we are going to have the Civil Society Malaria Declaration, which will be adopted and disseminated following the annual forum. And it's really all key CSOs regrouping their asks around gender equity and leaving no one behind in the fight against malaria. Actually, currently the draft of the declaration is still available. So if anyone is interested in adding inputs around this important theme, you can reach out, and we are going to share the link for the review. Then we are also planning a in-person events. As you may know, there's the 8th MIM happening in Kigali starting April 21st. And on the sideline at the MIM, we are organizing a special Women in Malaria session supported. And we are going to have guests from WHO, from Vestergaard, from Bill and Melinda Gates, from Impact Santé Afrique. And the goal is to discuss and highlight the role women play in malaria. Can be advocacy, research, managing malaria programs. And it's open to all participants attending the MIM, but there's the link you have to RSVP through. I can share it in the chat too. And men are very much welcome to participate in this Women in Malaria event. So basically, this is what we have planned for World Malaria Day. I mean, most of these contents are going to be shared through the toolkit we are going to publish on Friday. But I just wanted to add that apart from that, we also have a couple of tools that have been produced for malaria CSOs. And you can see it on my screen. There's a community-led monitoring guide. There's a document to help better understand the global funding process. And I can share the link in the chat too. So thank you.
Thanks a lot, Ségolène. Really good presentation, and yeah, exciting that you'll be able to gather so many people for the Civil Society Forum. Do we have any questions for the presenters from anyone in attendance? Either Ernest or Ségolène.
Hi, Quentin. One question. When the Global Fund products will be available? I mean, like a toolkit, or when will these be shared under embargo?
Ernest, I think that's for you.
Thank you. Our social media toolkit with all the products that I've spoken about will be available by Friday. It actually might come either tomorrow afternoon or Friday morning. So look out for it. Latest Friday, you'll have that.
And we'll make sure that it's passed on the GFAN list, so you have access to it. Thanks a lot, Ernest. Anything else from anyone? Do we have? I wouldn't mind. Sorry, Ségolène, if you can share the link for the draft declaration in particular, so that people get a chance to review and input. That would be wonderful.
Yes, doing it right now.
All right, thank you so much. All right, so I see no more questions. Is there? We have. Oh, Delphine, go ahead.
Sorry, it's not a question, but I'm not sure if it's the right time to share other plans for World Malaria Day.
No, it's not. I was just about to finish that sentence and say, please, if you have other plans to share, go ahead. No, go ahead, Delphine, go ahead. Sorry, I'm pulling your leg.
Oh, sorry, I'm being good. So when you say no, I switch off. Great. So yeah, I wanted to share the initiative that a few French NGOs are starting. So it's Friends of the Global Fund Europe, Élus locaux contre le paludisme, and Esprit d'Ébène. And so we have launched on the 3rd of April the campaign Team Zero Palu, so Team Zero Malaria. And so we're happy to announce that it's now officially launched. You can find us on all social media, on Twitter, Instagram, and from this week, later this week, TikTok and Facebook. And so this campaign will run for the whole duration of the Olympics. And for World Malaria Day, we are focusing on media because we've had the event already with high political figures, French political figures who took the floor. And so for World Malaria Day, we are going to have an op-ed signed by all the members of the Team Zero Malaria that at this exact hour includes Peter Sands and Philippe Duneton from United. And we hope to get also the CEO from Gavi to join as well, and potentially others. And it also includes lots of artists and athletes, of course, because it's around the Olympics. researchers from LMICs and from France, etc. So this, and then media opportunities around that. And this campaign has two objectives. One being the prevention and awareness raising in France amongst the diaspora, because France has the highest number of imported malaria every year, some ending in very severe malaria. And one of our champions is a young woman who has lost both hands and legs because of malaria. And so a prevention to the French people who travel to endemic country, but also, of course, a message of the need, a message to the French authorities of the need to increase their funding to malaria, with, of course, a big focus on the Global Fund. And this will lead to an event in August that we'll talk to you again about, that will be very much focused on the different partnership for malaria. So excited, and we count on you to amplify all that. For now, the campaign is in French only, but friends from Malaria No More UK have committed to translate our campaign to English, which would mean that Anglophone champions could amplify it too.
Thanks a lot, Delphine. Is there any other plans to be shared on the?
Yes, Quentin.
Yeah, go ahead, Cecilia.
This is Cecilia. So, CSOs, malaria CSOs in Ghana will be joining CS for Me in celebrating the World Malaria Day. We'll also be releasing press releases calling on donors to support CSOs and organizations, and also to support Global Fund, putting resources to support Global Fund to be able to work with community organizations, CS for Me, and other malaria partners. So it's also a time to call for donor investment and domestic resource investment. We will also be working with CS for Me with the MPs. We are mobilizing the MPs in Ghana to also share short videos with CS for Me so that it can be amplified on social media. Thank you.
Thank you very much, Cecilia. I don't see any other hands up. I assume that that's because all of our key partners on World Malaria Day have shared their plans. Speak now, be forever silent. All right, then we'll move forward to talk about a bit of a, well, not really 180, because malaria is going to be a key topic for the Global Fund board meeting. So let me get my PowerPoint back on. So the next, before I call on our colleagues from the three delegations, I want to give a few key points about the upcoming 51st Global Fund board meeting. So it's going to be a fairly light board meeting in terms of decision points. So there will not be a lot of decisions taken during the board meeting itself, but it's the start of a number of really important conversations. So in 2022, there was a revision to the allocation methodology that was voted on that increased the share of the money raised by the Global Fund during the 7th replenishment that would go to TB. But there was a decision taken by the board at the time that an external review should take place of the allocation methodology to assess whether it was still fit for purpose. And the results of that external review are going to come in now. And so we're going to have reactions from the Secretariat, reactions from the members of the board, and it's going to be the start of a conversation around the revision of the allocation methodology. Just for clarity, the allocation methodology of the Global Fund is really the core of the model. It decides on how how the allocation to each country is calculated and what the disease split, meaning the level of investment that will go to HIV, TB, and malaria, will be decided. So it was a tough and very controversial discussion in 2022 when the level of the disease split was changed in favor of TB, and there will be no key decision taken this time around, but it is going to be a very important conversation to keep an eye on. The other conversation that will be taking place is the continuation of a Lusaka agenda, formerly the Future Global Health Initiative. So 4 priority work streams have been discussed in committees last month, and the committees are going to report to the board and talk about how to better integrate work across Gavi, the Global Fund, and now the Global Financing Facility. It's an important conversation because it's an important conversation to a lot of donor countries, but it's unclear how much there needs to be a change in terms of how the Global Fund actually works, because a lot of that collaboration was already built in the recent strategy. So it will be an interesting conversation to keep an eye on. So the other sessions of interest, there will be an update from the executive director, which is always interesting, sort of see where the fund tends to go towards the replenishment. We'll also follow closely the resource mobilization update to get a sense of how much money is coming in, how much money is going out. And with regard to the decision points that will take place, there will be a decision on where the next board meeting will take place. It won't be in Geneva. There will be a decision point on the vector control policy, the procurement policy, and there will be a vote on the annual financial report and the external audit results. So all of those are, generally interesting, but really those 2 discussions on the allocation methodology and on the Lusaka agenda are what we're really looking to follow closely at GFAN. So now I want to invite first the developing country NGO delegation. I don't know who will be talking. I assume it's you, Cecilia, for your remarks and insights and perhaps disagreements with my overview. Please go ahead.
Okay, so Quentin, just to let you know that our position, we are currently working on our statements. We are all in Geneva now, working on our statement. And so, some of the statements are for input, some are just for information. So as you rightly said, looking at those that are for input, you raised the issue on allocation methodology, which is very important to us. And so we are discussing it and reviewing the whole methodology might not be the issue, but we need to look at where we have more issue on the malaria and TB cases where more people are dying of malaria and more people are dying for TB. We are discussing how we make input into that. The second thing is on the Lusaka agenda. You talked about the implementation of the 4 priority work stream, which is very important. And so we're looking at Global Fund, Gavi, and GFF working together. Our delegation still have few questions, and we are discussing, and for clarification, which is as we discussed this morning in Geneva, we are looking at how does this also look like for the Global Fund strategy that we are implementing. And also looking at what load of work are we going to be putting on the Secretariat to implement this, and how this will also influence our 8th replenishment, looking at where we are going as partnership, that's Global Fund. How does it look like for us as a Global Fund, especially where a lot of discussion is looking at working together with this? So we are asking that. On vector control, okay, on the ED report, I think the ED report has set the tone for us to know that we have challenging world, especially which will ultimately affect the future of Global Fund, looking at climate change and issues on malaria, and also looking at where most of the countries that Global Fund invests are all affected, especially in Africa, is affected by malaria. So our discussion is still going towards that, reading the ED's reports. And then today we discussed the resource mobilization and calling on the team to also strengthen domestic resources. I'm happy that CS for me is leading MPs in the various countries to advocate for more domestic resources. So today we had that discussion, looking at what is happening now. Most of the countries are going to election. And so how will the future be if new governments are selected? Are we going to start all over again? I think there's a lot of uncertainty in what we are discussing now. So I will stop here, and still if any of us want more talking point for us to include, we'll be happy to add. If they can be sent to you, Quentin, you can share with us so that we can include it in our talking point, because we are still working around all the input that the Global Fund expect from us. And also, if we have some questions for clarification, our delegation is ready to take it up and send to the board table, especially from the developing countries. Thank you.
Thank you very much, Cecilia. Is there any urgent question for Cecilia? And otherwise, we'll hear from our colleagues at the developed country NGO delegation, and then take all the questions at once.
All right. Thanks, Quentin. Thanks, everyone. This is Catherine Connor. I'm the alternate board member for the developed country NGOs. We agree with the priority items that you flagged, Quentin, in your presentation. Just to add a little bit to what Cecilia said, most of the decision points at this meeting have been sort of well discussed. And so really the topics that are being discussed from our point of view at the delegation are really some of the bigger questions around the allocation methodology, the sustainability, and some of the Lusaka agenda questions. So just on the allocation methodology, I think one thing that our delegation is very concerned about is the fact that the catalytic investments haven't really been discussed yet, as well as the disease split. So this is something we're eager to discuss more and highlight at the board meeting this week. We're obviously interested, much like Cecilia mentioned, about sort of how TB and malaria will be addressed in the next allocation methodology. But this early in the process, it's really about sort of raising questions versus making decisions. So we're eager to have those conversations this week. But imagine that there'll be a lot of robust discussion. On sustainability, we are sort of also kind of really looking towards hopefully having a sort of independent evaluation on that. There's been some discussion about changing that policy, and we're really heavily invested in making sure that there's a review done before any changes to that policy take place. So we're also discussing that. On the Global Fund and the Lusaka agenda / how they work with Gavi and the other global health institutions, I think that a lot of questions have been asked over the past 6 to 8 months, and we're really eager now that we're finally seeing some of the detail around how the Secretariat intends to have the structures really integrate or work with other parts of the global fund governance. So as I think Cecilia kind of noted, some of the things in the areas of alignment are very operational and again will affect how the Secretariat works, but we're eager to make sure that none of these sort of operational adjustments and alignments start to impact how the strategy is implemented or any of the government's issues that we would see as not being appropriately wrapped into that. And then just on a couple of other issues that are of interest to us this meeting, there's still kind of continued discussion around board representation, making sure that the board has the right number of seats with the right number of representatives on there. And so that's a discussion that's going to be happening a bit during, I believe, the board retreat. We also really want to focus on sort of how the Global Fund uses its diplomatic voice. Some of you may have seen a letter that our delegation did around the Global Fund being stronger on some of the Uganda issues. And so it is something that we are eager to see more of out of the Secretariat, but also potentially part of the advocacy roadmap. So really, and then also sort of in that same vein, funding around human rights and advocacy for key populations in the countries. I think that's it for our highlights anyway.
Thanks a lot. We had a question in the chat about the Gavi Global Fund joint board meeting and feedback/updates. Any thoughts, you or Cecilia?
I don't think I don't know. Sorry, I'd have to look at my notes. I don't have any thoughts off the top of my head.
Exactly. I think was it the call, the board, the Global Fund and Gavi call?
There was an information call, but it wasn't a board meeting.
Yeah,
So
it was the board, the Global Fund and Gavi board call that we had recently to discuss the ways of working. Well, I think it was something that our board, our board leadership and the Gavi CEO led, looking at the Lusaka agenda, not in quotes, but more working together with Global Fund. I think this discussion also was a whole deliberation on how the future looks like. And then we gave our various statements. Our concern on that was, I think I have a few points on my phone. The first concern we had, or maybe what our delegation talked about, was how just a minute, I'm just going to our delegation talked about how it will look like if we put the three organizations together. And we also raised the issue of resource mobilization. We asked a question that the key issue that we are grappling with is how to prioritize the interventions at country level. Given that donors are unlikely to fully fund both the vaccines and other malaria interventions that we know are cost effective, because the donors can decide what to fund, and it is also something we are looking at what will happen, because these are two different organizations. I know Gavi focus a lot on vaccine RSSH. Global Fund work more with civil society and communities at the center. What will happen if Global Fund has TB, HIV, malaria funding, and maybe there is more resources for RSSH? How will the two organizations manage that? I think we asked that they should really look at it. If you look at the modeling cited by WHO, estimate of about 500,000 children lives could be saved over 11 years, over 2024, 2035, with addition of vaccine to current levels of other malaria control interventions. So we are looking at what will happen if we don't have the resources, especially where we are looking at the shrinking and dwindling resources now. And we know that the vaccine is very important and efficacy is assured. Where would the resources come from if we don't have it for the vaccine and the malaria? I think our questions continuously look at the uncertainty within this collaboration, and from civil society and our developing country NGO point of view, we actually want more clarifications. We know that malaria and TB have new tools, but these new tools, how are they sustained? How will it come to the countries? How will civil society and communities support this? Because we need stronger voice of civil society and communities, especially at community level, at the grassroots, to mobilize people to use it. For vaccine, we need to mobilize civil society, mothers. How are we part of this conversation? Because we realize that we are missing in some of these conversations. So these were some of the things that we talk about. Thank you.
Thanks a lot, Cecilia. Do we have any, sorry, first Catherine, do you have any additional thoughts on the Gavi? No, I see.
No, I was conferring. I was not on that call, so I wanted to make sure I was getting it. And everything Cecilia said, we're pretty much in line with it. We really just the lack of detail and sort of the lack of understanding still pretty obvious from the folks who attended the call. So I think we're all sort of pursuing better understanding of how this is going to work in the future, but nothing to add beyond alignment there.
All right. Thanks a lot. Any additional questions or any colleagues from the communities delegation that have been able to join the call? I don't see anyone that I know. So, but if you're there, please make yourself known. Any more questions for the delegations on the upcoming board meeting? Yeah, go ahead.
Hi, Quentin. This is Olivia from the communities. Our delegation is actually meeting now with the French and then later with the German constituencies. So we will share our updates by mail, but we are very concerned about the Lusaka agenda, but also about the fact that there are still a lot of missing communities, lack of funding and gap. And that is very important for all partners to refocus. So the Lusaka agenda is one of our big concerns at the moment, where we need to be more refocused, especially before the 8th replenishment coming up. So we'll share our update by mail after all the meetings today.
Thanks a lot, Olivia. Yeah, sorry, we didn't realize that you were meeting at the same time. I don't see any additional questions, so we'll move on to the agenda. I want to thank the three delegations for making the time and joining us and giving us those updates. I think it's been a few board meetings where we try that format of having a short briefing ahead of a board meeting and then a full debriefing afterwards. So we'll welcome all of you back in 2 weeks for a full debrief of what did in fact actually happen at the board meeting. But in the meantime, thanks a lot for joining us and for your insights. So on the last theme, the last point that we wanted to touch on today was the GFAN Global Strategy meeting and our key reflections. Some of you on the call were able to attend, and we thank you for that. So GFAN every year brings in key partners. We had about 90 people this time around in a different city every year for the past 3 years. We were in Bangkok in March, and the idea behind the meeting was to coordinate and strategize 18 months from the 8th replenishment. So we had 3 days to do that, and I want to come back with some of the top-level thoughts we had during the meeting and some of the key priorities we'll have for the next year and a half. So the first thing that really came through throughout the conversations was how busy the calendar was for everyone over the next 18 months. So we'll have 2 G7, 2 G20s, it's 824 this summer. TCAD will have a ministerial meeting this summer, and then the full TCAD in the summer of 2025. There is a high-level meeting at the UN on AMR, on antimicrobial resistance. There's the World Health Assembly, the World Health Summit. There'll be the Summit of the Future in New York in September. COP29 will take place before the replenishment. And so as advocates, we're going to be pulled in a lot of different directions. We're going to be, and these are the global events, there's regional events, there's national events. So there's a real risk of competition distraction in terms of our advocacy towards the replenishment. So across partners, we saw the key to handling the next 18 months and the replenishment campaign was going to be to prioritize, identify where is it worth to invest our time, divide and conquer, identify leaders for each of the different opportunities so that not everyone tries to do everything all the time, and supporting each other by providing spaces for people that for other advocates that perhaps weren't able to secure space or attend one of the specific events, perhaps they missed the deadline, perhaps they missed the visa, who knows. and just making sure that we work collaboratively and present a united front, because there'll be a lot of opportunities to engage with decision makers. So we have to be careful to coordinate to avoid duplication, and make sure that we speak with one, perhaps not with one voice, but with one aligned message at least. The other looming threat is really the number of elections that are coming up. There will be elections in 13 donor countries over the next 18 months. So all major donors pretty much will have a contested election. And this poses a number of challenges logistically. It makes it difficult to identify a host for the Secretariat. But beyond that, a lot of governments are now willing to make commitments just before the election year. So even though we heard from the Secretariat that they were trying to engage as early as possible to aim for early pledges rather than a lot of pledges at the pledging conference, whether they will be successful is unclear because of the number of elections that will be coming up. Of course, the big one being the US election coming in September. It's a big one because it's 30% of the resources of a global fund are at stake. So it was a very, very concerning prospect to see the return of the Trump administration in the US. The other challenge is the number of other fundraising events that will be taking place. WHO, Gavi, the GFF, Pandemic Fund, all we have some sort of replenishment in the before the global fund does its own. So there's a real risk of donor fatigue, and that's where we see the Lusaka agenda and the Future of Global Health initiative really loom its head. Part of the reason why these conversations are coming up is that donors are pushing for closer coordination because they are seeing a lot of need, and they would like some of that need to go away or be compressed into a single moment, etc. So there's definitely going to be a need there of coordination and collaboration across advocates. There's no reason to fight over which part, how big our share of the pie is going to be. We need to work together. We all have our lanes, and stick to it and support colleagues that are doing their own fundraising in the next year, and keep our eyes on the price for aid replenishment. So these were some of the key messages. These are some of our priorities at GFAN for the next year and a half. This is still a bit rough, and I apologize for the amount of text on screen. But we identified a few areas where we thought that global facilitation was particularly useful and welcome. The first one was going to build evidence base for replenishment from a civil society and community perspective. So we need to have a needs assessment that is ambitious, that is realistic, and that makes clear if we don't meet the needs that we know are there, what does that mean in terms of lives lost, in terms of disease trend, etc. And on the other hand, if money is there, what can we gain? Can we make it to the 2030 targets? Can we actually, how much will it take to end the epidemics by 2030? And a lot of the conversations that are taking place are contrasting vertical versus horizontal approaches, and are putting the global fund on the vertical side of things. And we need to fight those rhetoric. We need to make clear that investment in some of the three diseases that kill among those people are investment in building resilient health system and expanding UHC. It's essential to fight HIV, TB, and malaria if we want to achieve resilient health systems and if we want to achieve UHC. So that's a message that needs to be articulated and come across clearly throughout the campaign. We heard a lot of colleagues from donor countries talking of donor and HIV fatigue, and something very clear that came across throughout the meeting was the need to refocus towards the basics. We have spent a lot of time investing in parallel in tangents in global health, we work on HIV, TB, and malaria. That's the core role of the Global Fund. And we really need to remind everyone that, yes, there's a lot of challenges, there's a lot of problems. We just talked about malaria. We've been hit by COVID hard, but we have a model that works. We know why it works, and we need to remind the donors why they put that model in place in the first place, and why it's really worth funding it and fully funding. We need to handle, I mean, you're all very aware, there really is a backlash, a pushback globally against human rights, against civil society spaces, and we need to coordinate a way to fight back. We see it with the number of homophobic laws that are being implemented in a number of countries. There's a myriad of ways where we see the space for work reducing, and we need to find ways to be as coordinated as our our adversaries or enemies are. So that came back again and again during the meeting. We don't really have a clear path, but there really is a need to think hard about how we can unite forces and push back. And finally, some reminders around what are going to be the key calendar events. We have a results report that will come out in September, the investment case early 2025, the preparatory meeting and pledging conference. So the preparatory meeting will be in early 2025, a pledging conference, sometime between August and November 2025. And for each of these events, GFAN will provide analysis, briefs, debriefs, and bringing people together to support action and communication. So these are our plans. We're running short on time, but if any of you have any question regarding our priorities and what was discussed during the meeting, please raise a hand. All right, I see limited enthusiasm. I assume this is general support, and it's very much appreciated. And so closing a few announcements. I'm just gonna put a few things in the chat. So we are organizing with a number of partners a number of webinars in the next 3 weeks. Oh, it's in chat. So we'll have a first webinar with Pandemic Action Network, Stop AIDS, and ASO, WACILAF, and GNP+ on sustainable financing for a pandemic agreement. And so it'll take place on the 25th of April. And we'll have people from the Global Fund, from the WHO, from Gavi, and from the Pandemic Fund will come together and sort of tell us how they think the pandemic agreement that is being negotiated can be funded. We hope to have very high level representation from each of these institutions, and we really think it's going to be an interesting discussion. So we encourage all of you to join us. There's the link to do that in chat. Also with Stop AIDS, as well as WACILAF, GNP+, the Global Fund Secretariat, and ITPC, we'll have a webinar about the Summit of the Future, which is a summit that will take place in New York in September, and talk about the implication it will have for global health. So we'll send invitations on the listserv soon on that webinar, and we again hope that many of you will be able to join us. And finally, we've been approved alongside a few colleagues, including Stop AIDS, GNP+, and ITPC, to hold an offsite online event at the Civil Society UN conference in Nairobi. So it will be integrated in the main program, but it will be a webinar. Again, more information will come shortly, but expect to hear from us regularly in the next 2 weeks. We'll have a few of these conversations on different topics. And finally, on the 1st of May will be our next GFAN call, and we'll focus on a debrief of the next 51st Global Fund Board meeting. I think we're exactly on time. I want to give a second for anyone who would have a last second question, and otherwise I want to thank everyone for joining us today. We will, as usual, put the recording of this call on our website in the next couple of days. Thanks, everyone, and have a great day, evening, afternoon. Bye-bye.
Thank you, Quentin. It was very enriching. See you next time.
Thanks, Conte.
Bye-bye.
Thanks, Quentin, and bye.